Our news is brought to you by Alive.
Believe in best.
Good evening, Bahamas. Coming up in our news tonight, health professionals reveal the real threats of the third wave of the COVID-19 pandemic. The Pan American Health Organization secures additional vaccines for the region. We'll tell you how. Plus, a mental health check for those working on the sea during the pandemic. Good evening, Bahamas. You're watching our news. I'm Georgie O'Bain. Topping news tonight. Former Health Minister Dr. Dwayne Sands is criticizing pandemic partying, saying it's a dumb move to host a large gathering in the middle of a third wave. Asked his thoughts on the large gatherings and parties that have been happening in recent weeks, Sands was highly critical.
No disrespect, but it is just plain dumb.
Sands says any indication that there may be COVID variants in the Bahamas should be concerning for young people.
If you believe that you are going to survive because you're young, understand that with the new variants that are out there, young people are being struck down with COVID. People in their 30s in the Bahamas now hospitalized with COVID. Seriously ill from COVID. So this is not just a disease of older people or people with comorbidities.
Earlier this month, it was revealed that preliminary PCR screening of 10 recent positive COVID-19 samples detected genes associated with variants of concern, indicating the possible presence of COVID variants here in the Bahamas. The screening was conducted by the National Reference Laboratory. The samples were sent to the Caribbean Public Health Agency for further testing. The Ministry of Health will not be able to confirm whether any of the 3 variants of concern, South African, British, or Brazilian, are present in the Bahamas until it receives the results. In January, health officials said that the Bahamas does not have the capacity to test for new variants of COVID-19.
As we determine the phylogenetic status of the COVID virus that is in the Bahamas, we may come to find out that we have some aggressive strains. But why wait until then? Let's go ahead. A word to the wise is sufficient.
The local healthcare system is already feeling the pressure of the increased COVID-19 cases. Medical professionals weighing in on how to best tackle the third wave of COVID-19 pandemic while appearing on this week's episode of On the Record. The first step in managing the third wave, according to the president of the Physician Staff Association, Dr. Sabrika Pinder-Butler, is to be extremely cautious considering new variants, given the recent spike in COVID-19 cases. Dr. Pinder-Butler says the spread of the virus could prove to be more deadly.
We know that with certain variants, it could mean in simple terms that it would be easier for persons to be able to contract COVID-19. And certainly if it means that the transmission is easier and we're already having an increase in cases, it could mean that more persons may be easier exposed to COVID and could contract the illness. When that happens, Jerome, and we already have a situation where we're seeing community spread.
While Dr. Pinder-Butler believes better investigation of new variants is necessary, Dr. Indira Martin, director of the Bahamas National Reference Lab, says that might not be so easy.
As a developing country, I think we have to take a pragmatic view on it. We have to determine whether there is cost benefit to doing these extra testing, which will involve extra equipment, extra personnel, budgets, and so on. We have decided to do in-country PCR screening for variants of concern. And what that allows us to do is it allows us to prioritize which samples to send off for sequencing. So given our constraints, I think that's probably the smartest way for us to go about determining what's happening in country genetically, and also probably the most pragmatic way. We don't have gigantic universities like in the United States and in Canada and so on, where a lot of the sequencing is actually happening.
The impact of the third wave is already being felt, according to Dr. Pinder-Butler, who says the depleting number of health professionals will definitely impact health care this wave.
What is most concerning at this time as compared to, I think, our last ride of this wave of COVID is that in this instance, we still have those same healthcare challenges as it relates to spacing. We perhaps may have even less staff than we did in the first instance because we have lost some of our healthcare providers. We've certainly lost a significant amount of nursing staff. We've lost physician staff. Either they have found employment at other places locally or abroad. And so when you have all of those things coming together, because we know that we will need a team effort.
The Pan American Health Organization kicking its efforts to secure additional COVID-19 vaccines for the region into overdrive, as the organization's director announced plans to secure excess vaccines from countries including the United States of America and Spain. XX vaccines secured by developed countries should be on the way to the region, according to PAHO Director Dr. Carissa Etienne. Etienne this week thanking the U.S., who has committed to releasing some 60 million doses of the AstraZeneca vaccine to the COVAX facility.
The announcement from Spain is a show of solidarity and a contribution to the well-being of our region. We also congratulate the United States government on their announcement earlier this week that they will share up to 60 million doses of the AstraZeneca vaccine. We see these commitments as very important steps in the right direction, and a trend we hope will be followed by other countries that are able to donate.
Vaccines from Spain will be prioritized for the Caribbean and Latin America.
In its commitment, Spain indicated that this donation will be channeled through the COVAX mechanism and prioritizing Latin America and the Caribbean. PAHO, through the revolving fund, will likely oversee the distribution to our countries. But as now, no specific recipient countries have been identified. We continue to be in touch with Spain about the timelines and the quantities that will be donated. And once that picture is clearer, PAHO will propose a strategy that is focused on equity, with special consideration to those countries that have had limited access to vaccines up to this point.
Etienne long condemned the inequality of vaccine access in the region and counts these commitments by the U.S. and Spain as a step in the right direction.
No vaccines should be sitting in warehouses where they can be promptly used to save lives. And PAHO is ready and able to quickly deploy vaccines to the countries in our region that have been and are being heavily impacted by the pandemic and are now struggling to access more doses. As I said earlier, our member states have demonstrated the capacity to effectively deliver these vaccines to help protect their health workers and vulnerable populations.
The Bahamas is expected to receive its second shipment of the AstraZeneca vaccine through the COVAX facility this month. Well, COVID-19 case numbers among people 25 to 59 years old are rising in the region, according to Director of the Pan American Health Organization, Dr. Carissa Etienne. The spike in cases leading to an alarming increase in hospitalizations in
Since
several
the beginning
countries.
of 2021, several countries in our region are reporting an increase in cases in the younger population, linked to increased exposure and no vaccination in these groups. This has led to an increase in hospitalizations. The hospital stay of these age groups is usually greater compared to those over the age of 60.
During this week's press briefing, the Bahamas was listed among the countries in the region experiencing a spike in cases. Dr. Etienne revealing that hospital stays for younger patients with COVID are longer.
PAHO is orienting our countries to plan on coping with sudden increases in the consumption of critical inputs such as oxygen, intubation drugs, personal protective equipment, and infusion pumps. Canada's infection rates have surpassed the U.S. figures for the first time in the pandemic. Cases are also surging across the Caribbean, as Guadeloupe, Martinique, and the Bahamas are reporting new spikes.
The PAHO director is encouraging countries like the Bahamas that are experiencing a spike in cases to take the necessary steps, no matter how difficult they may be.
It is no surprise then that many countries in our region have tightened public health measures by extending curfews, limiting reopenings, and imposing new stay-at-home orders. Of course, these decisions are never easy, but based on how infections are surging, this is exactly what needs to happen. We know that these measures work, and I commend leaders across our region for putting health first.
Still to come on our news, an Abaco MP defends the recent demolition of shantytowns. Plus, we take a closer look at developing good mental health habits, but first examining legislation to protect our cyberspace. That's coming up when our news returns.
Why do we have programs on commercial in Spanish?
Unfortunately, the Bahamas and the rest of the English-speaking Caribbean is lumped in with Latin America, and the giant US networks send us Latin American feed into this region.
Oh, so that's what the message means on YouTube and Netflix.
Exactly. Restrictions on regional rights impacts all content providers for Cable Bahamas and our regional partners. The fight is about getting English-speaking content into the Caribbean, which we've been very successful doing with HBO, as well as ESPN Caribbean.
You're watching our news. Welcome back. North Abaco MP Darren Henfield recently defending the decision by the government to demolish parts of the farm Shantytown, which happens to be in his constituency. Structures in the farm were demolished last week as a judicial review hearing continues. Shantytown residents are challenging the government's policy to rid the country of these communities.
We were stopped in the courts. We saw what happened on the 1st of September when Dorian came in. We lost lives, and we don't even know how many. And so we are determined to remove irregular communities that are in existence in the Bahamas, not in accordance with the laws of the Bahamas.
Henfield tells our news that the country has laws for a reason and nobody is above them.
The inhumanity or humanity of what is going on is neither before us now or futuristically. What we want is people to be able to live. It's inhumane for people to be living in such substandard conditions. That is what is inhumane. And I understand his point, but we have to follow the laws of the country.
Attorney Fred Smith QC is representing Shantytown residents and has criticized the government for moving ahead with the demolition ahead of the judicial review. The hearing continues on May 21st. Well, senior members of the Royal Bahamas Police Force are keeping a close eye on concerns of corruption on the police force. Assistant Commissioner of Police and Officer in charge of Grand Bahama, Ashton Greenslade, recently addressed the matter, saying members of the public should feel comfortable coming forward with complaints against officers.
I'm asking members of the public to please, if an officer offend you, or if you feel an officer commit an offense, to come and see me or see the commanding officer of whatever policing division it occurred in and let them direct you to the complaints and corruption.
Assistant Commissioner Ashton Greenslade warning residents to not take matters into their own hands if they feel threatened by a police officer. Rather, he says the proper channels are the way to keep everyone safe.
When and wherever persons report that the police abuse them, use obscene language towards them, or treat them unfairly, I sometimes summon those persons to my office, and I have an officer escort them to the Complaints and Corruption branch where they lodge their complaint and it is dealt with fairly.
Asked if he's pleased with the results of the Complaints and Corruption branch, Greenslade says it's yielding positive results.
Absolutely. If you, in recent times, you would have seen a number of officers placed before, not here in Grand Bahama, but in Nassau, placed before the open court and lost their job because of complaints made against them. The commissioner had the matters investigated, and the chips fall. If the officer was found wanted, he or she was placed before the court.
Greenslade says protocols have been put in place to address complaints and concerns about police officers. The Bahamas is not doing that well in protecting its digital infrastructure from cybersecurity threats, according to Minister of State for Finance Kwesi Thompson, who highlighted the government's plan to correct that issue. According to Thompson, the country is currently undergoing a national assessment of its system's level of risk by the International Telecommunications Unit. As the government begins the process of moving services to the digital space, Thompson says the country's cybersecurity needs to be bolstered to mitigate any threats to the government.
The first thing is to do a nationwide assessment, nationwide cybersecurity assessment. So there are teams that are coming in from the ITU, and they're working with our local teams, and they're going to be doing assessments not just for our government infrastructure, but our national infrastructure. And so that is going to tell us really where we are and what position we are and what improvements we need, what things we need to put in place.
Thompson, who leads the government's digitization efforts, says the next step is to build capacity, draft a national policy to develop the necessary legislation to punish those who commit cyber crimes against the country.
The second thing that we're doing is we are also building our capacity in the government when it comes to cybersecurity. So we've already had some advertisements out there. We've had persons who have applied for certain positions with respect to focusing on cybersecurity, and we will be building our capacity when it comes to cybersecurity. The next thing they're going to also be doing is helping us with legislation. So our legislation needs to be beefed up. Our cybercrime legislation needs to be beefed up.
Thompson explains that the ITU is assessing the government and the private sector's risk of cyber attacks, while also helping the country to develop a cybersecurity emergency response team.
Most importantly, what they are helping us to put together is a CERT, which is a cybersecurity emergency response team. What that will do is it's going to be a full-time team that will be doing analysis. So they're going to be monitoring our systems. In addition to monitoring them, they will be prepared to respond to any attacks or any incidents that happen. So we are very mindful of where we are with respect to cybersecurity, and that's why this process is in place now.
The onset of the COVID-19 pandemic and subsequent lockdowns left many Bahamians stuck in their homes. But imagine the lives of those seafarers who were stuck on the ocean, unable to make port. The Bahamas Maritime Authority is now taking a closer look at the impact the pandemic had on the mental health of those who work at sea. BMA Deputy Director Tom Jenkins says the pandemic has impacted everyone, especially those members of the industry who form the backbone of the world economy and extend a lifeline to so many. A digital survey has been introduced in collaboration with the University of Washington School of Public Health to look at the emotional, physical, and mental strain experienced over the course of the pandemic. The survey is available on bahamasmaritime.com. When our news comes back from the break, a Bahamian fashion icon takes us behind the scenes of her 40-year-old business. That and much more. Stay with us.
Wake up with Bahamas at Sunrise on RTV Channel 212. We are live at 6:30 a.m. on Mondays and Fridays, with rebroadcast at 8 a.m. on Mondays, Wednesdays, and Fridays, and 9 a.m. on Saturdays. Bahamas at Sunrise brings you the best in Bahamian entertainment, current events, politics, and more. With us, your hosts, Anastasia Palacios and Phil Simon. Bahamas at Sunrise, the best in Bahamian morning television.
Progressive Liberal Party Deputy Leader Chester Cooper says he's worried by data that shows that the Bahamas is at the bottom with its rate of COVID-19 vaccination. According to Cooper, as countries are ramping up vaccination, the Bahamas is lagging behind.
The standard protocol nowadays is that we ramp up on vaccinations, but we're moving too slowly. I am alarmed when I look at the statistics showing the Bahamas at the bottom of the pack in terms of our percentage of vaccinations, and I think this ought to be the focus of the government. I hope that we have enough supply on the way in to cause this to happen.
On Thursday, Prime Minister Dr. Hubert Minnis urged employers to encourage workers to get the COVID-19 vaccine. Cooper stressed the importance of the Bahamas reaching herd immunity so the country can return to normalcy. However, he acknowledged that there seems to be a discouragement between the government and health professionals on the way forward on vaccinated individuals. He also questioned the need for a travel visa.
And we are requiring Bahamians pay for a travel visa to travel between the family islands for inter-island travel. And yet, when you get to the airport at the airline, you are asked to produce your COVID test. So if I have to get a COVID test, why do I have to pay $25 for a health visa and still be asked to produce the COVID test at the counter?
And this week marks the start of Mental Health Awareness Month. The aim is to shine a light on the importance of good mental health.
May 2nd, the Bahamas National Reparations Committee will be hosting a webinar, and it's called Mental Health and the Ma'afa. That's at 4 p.m. on Sunday, hosted by Dr. Nyambi Hall Campbell-Dean, who's also an assistant professor in psychology at the University of the Bahamas. And so that's an interesting webinar because we're going to look at the impact of the enslavement of African peoples, of which many of us are descendants, and how that's impacted our mental health.
Dr. Stephanie Hutchinson of the Mental Health Awareness Month Committee says this month's events are all about getting people to take their mental health well-being seriously.
We want to shine the spotlight on the fact that if we think about mental health as part of health, then it's an easier sell, it's an easier package to buy into and to check into one's mental health. And so I think it's really important to make those linkages, because then those people who have mental health issues will feel more comfortable coming forward for assistance. They'll be more comfortable talking about their experiences and not being stigmatized or not being seen as outcasts because they're dealing with this issue.
A webinar, book reading, and other events have also been planned. And if you want to give, you can go to Dairy Queen, who have decided to go green for Mental Health Awareness Month.
So they have partnered with us to provide specialty blizzards that are green, mint Oreo and the mint shake, because the color for Mental Health Month globally is green. And so that's a way to get people aware, but in maybe a non-threatening way, maybe an easier way to kind of ease them into it, because I know mental health tends to be a bit scary for some people.
Well, when our news comes back from the break, it's hats off for Mother's Day. That's coming up when our news returns.
Why do we have programs and commercial in Spanish?
Unfortunately, the Bahamas and the rest of the English-speaking Caribbean is lumped in with Latin America, and the giant U.S. networks send us Latin American feed into this region.
Oh, so that's what the message means on YouTube and Netflix.
Exactly. Restrictions on regional rights impacts all content providers for Cable Bahamas and our regional partners. The fight is about getting English-speaking content into the Caribbean, which we've been very successful doing with HBO, as well as ESPN Caribbean.
You're watching our news. Thanks for staying with us. Well, Judy's Hat Shop has been a staple in women's fashion here in the Bahamas for more than 40 years. And according to the lady who got it all started, it wasn't always easy following her fashion dreams, but it has definitely been worth it. Flowers, feathers, and fascinators, all made by hand. The gift started when Judy Mae Gardner-Strawn was invited to a wedding weeks after her first wedding. But with a limited budget, the new bride was forced to tap into her resourceful side.
There we was. I went back to Melissa and bought a frame, covered up, and then she was able to pick up a hat. But of course, we didn't stay there because the frames were $35 and I only charged her $45. So of course, he didn't make no money. I didn't really know the prices and the price at that time. And then we went, we started trying to find how you make it, how you get the frame. And we started with pin kettle cans and pot covers and different things, trying to make the top and the bottom. And then we gone from one level to the other level. And of course, as we went along, God intervened.
Judy's creations became a staple at events such as the annual Baptist Day Parade.
A hat like this would take you like about 3 days.
What goes into making those one-of-a-kind fashion statements?
This hat, I wanted to make a statement with it because it's the circle represents this around the world. I was just thinking about something around the world, and so I said, I'll just do a big circle that represents the world, and this here is the earth where we sit on.
The business took many hits over the years, but none as severe as the COVID-19 pandemic.
Pandemic came, and history is itself. It tells its own story. The business that I do is hats, where there's no funerals, there's no weddings, and there's no anniversaries, there's nothing. And so I had to fold up and come here, but I got this building back through my divorce with my husband, and it came just in time. For God certainly knows all things.
But now Judy is looking towards bigger things, such as this week's Mother's Day sale.
We're currently having a sale now, buy one of anything in our store and get one free. That's our Mother's Day special. Whatever we have here, if you come today, tomorrow, Saturday, you buy one, you get one free. Once you buy it with the same price, let's give an example. If the hat you purchase is $135, then you can get a hat that is valued $135 free.
Well, thank you so much for joining us for our News Weekend edition. On behalf of the entire team, I'm Georgia Bain, and we'll see you right back here tomorrow night. Have a beautiful evening, Bahamas. Madia's family reunion starts right now.